So the question was, if I have histamine issues, but I'm known to be allergic to antihistamines, how is that related? Well,
Right.
what happens is it makes it harder to deal with histamine issues from a conventional medical standpoint, right? Because
Yes.
if
Yeah.
you're a nail and they're a hammer and you're allergic to their hammer,
Right.
what can they do? So in that instance, you have to find a doctor or someone that can help you deal with the histamine in a without something you're allergic to. And
Right.
so from a natural perspective, if we back up a minute, in the immune system, there's cells called mast cells. And mast cells are the cells that um, contain histamine. And when an IgE antibody that's holding an antigen that you're allergic to docks on that mast cell, it pops. You could imagine it as popping, and it releases a bunch of histamine. Okay, and then histamine has its effect. Now, one way that conventional medicine, tries to combat histamine issues and significant histamine issues like a diagnosis called MCAS or mast cell activation syndrome. Another diagnosis is mastocytosis. Spell that wrong. One second. Mastocytosis. So these are both issues of mast cells going way overboard and releasing a ton of histamine. So the drug that medicine, first of all, they don't have good drugs for this, but their best drug is called cromolyn.
Hmm.
Cromolyn. And
Yeah.
that is that's called a mast cell stabilizer. That's the goal. So what it's trying to do is stabilize or prevent this mast cell from popping and releasing the histamine. Okay. Well, again, it's not a great drug. It's the best drug they have. Nature has a better version of that for you that you can find. Hold on, let me give you a different color. Let's give it this one. So in nature, in apple skins and onions, there's a component called quercetin. And this head to head in studies against cromolyn beats it every time for mast cell stabilization. So, if you're allergic to cromolyn or you just want something better than cromolyn, even if you're not allergic to it, in the scientific research, quercetin beats it. So that would be something to use as an antihistamine or more specifically a mast cell stabilizing uh, strategy for your histamine issue.
Okay. One of the things I was told, this is through the allergist, actually, was to use simple things like saline solution to be, cleaning out your nose, that kind of thing, passages.
Yep.
Maybe taking what's that one that's been around for a long time? It's not that well. I've never heard of the cromolyn, but Benadryl, the old-fashioned
Yep.
Benadryl.
So you're not allergic to Benadryl?
I'm if it doesn't have all these additives in it, then they just say take some, go to bed, go to sleep,
Okay.
and take Tylenol if you have if that's needed. But that's been the allergist because my whole body breaks out with things like Zyrtec and a bunch of these others. I've tried about 3 of them.
Okay.
And my body breaks out in hives and
Yeah, so the antihistamine results in a histamine response,
yeah, right.
paradoxically.
Mhm.
Um,
Okay, but I didn't know about onions and apple skins. Okay.
yeah, so quercetin would be the component of those things that is useful.
Okay.
And that's useful for any, histamine allergy type symptom. Thinking of that, whether it's you're thinking about eczema or food reactions or sinus infection. You may have heard of quercetin. The average person has probably heard of it because of COVID, because in COVID, quercetin's it's also what's called a zinc ionophore. So it does what ivermectin does. And so when you couldn't get ivermectin, you could use quercetin.
Oh,
And
okay.
ivermectin has 22 different reasons that it could be helpful. But one of them was zinc ionophore, meaning it drives zinc into the cell better, and zinc is antiviral. Well, quercetin will do that too. So that was another use for the quercetin. And then for allergies, you know, if the allergies are coming with a lot of mucus, and it's kind of a, you know, a lung sinus mucusy symptomatology, another great natural strategy is N-acetylcysteine, or NAC, or NAC, depending on, you know, what the person's calling it. This is antiviral, but in addition, you know, from a mucus standpoint, it's also what's called mucolytic. So this will go break up the mucus and give you more productive coughs and let you, you know, get the junk out of there faster. So, you know, if the lung issue were like a viral, you know, a viral reason that you were like a viral pneumonia or something that you were very mucolytic, NAC's the double whammy of it's going to kill the virus and also help break up the mucus for you. And then it also blocks, you know, so we talked in a question, you know, a couple of questions ago, we talked about those Th2 cells, which drive the histamine response. Well, NAC will block the development or the maturation of that baby naive T cell into the Th2 cells. So you get, again, multiple pathways by which you're antihistamine without taking an antihistamine.
Okay, thank you.